Hi everyone, welcome back to my channel and thank you so much for choosing to watch my videos. If you're new here today, my name is Betty and a warm welcome to today's video. We have a guest here today and she has been here before in this channel, and the last time she was here she shared with us her journey from being a caregiver to a CEO. She started her own empire here in the US. So guys, that tells you that everything is possible with hard work. And today she will share with us her journey of a project she has started, and she's working on it back home, back in Kenya. And without further ado, let me welcome her. Welcome, Christine. And due to public demand, oh my goodness, a lot of people from the last time you were here, so many people asked me to bring you back. You inspired so many people and you gave so many people hope. So welcome back to Betty AZ.
Thank you so much, Betty, for having me back here. I received a lot of positive feedback.
Good.
A lot of people reached out, and I hope I was able to help them and motivate them and inspire them. And due to public demand, like you said, I'm back here, and thank you so much for having me back. I appreciate you.
I appreciate you as well, and please share with us and tell us about this project you're working on back in Kenya.
So Betty, the project that I'm working on, I started thinking and praying about it a year ago, believe it or not. And I really wanted to make a change, and that has been my dream, to make a change and inspire people back in our country, Kenya. And so after a lot of discussions and after a lot of research, I started New Health Medical Center and Rehabilitation. Okay. And what it is, it's a rehab center for addiction and mental health.
How are you able to manage something? The last time you were here, you told us you have business here in Arizona and in Nevada, and now you're telling us about something else back in Kenya.
You know, I think number one, it takes God. Like I told you last time, I think it takes God. At times I look back and I'm like, how do I even do it?
I wonder how you do it.
But I think it takes God, and putting God first. Like I said, before I started this venture, one of my kind of divisions and you know, what I had to work on is my children, and how, you know, traveling internationally, how it was going to impact my personal life. Yeah. Before anything else, because before anything else, I'm a mother. Yeah. And so I think I worked things around, and this is a calling, and I wanted to do what I had to do to make a difference, and it has always been a dream, so it was practically a dream come true. Yeah. So what I normally do is 3 months in, 3 months out. Okay. But when I started the project, I wanted to train my own personnel. I wanted to train my own team of employees. Yeah. So basically, God blessed me with a good director. Her name is Audrey. And with Audrey, we were able to work on the model that I dreamt about and what I wanted to see happen. So remember, you start from a dream to fruition. Yes. So after the research, I was blessed with a good employee by the name of Audrey, and she worked on the policies, the employee files, and all that. So in the month of June, I spent the entire month of June back in Kenya. Oh. And what I did is I would wake up in the morning, go to a conference room, and train the employees. Wow. The model I'm trying to bring to Kenya is how we deliver healthcare. Because that's a thing that I believe everyone in the diaspora wants to see. The greatest and the best healthcare, you know, providers. And it takes one person, 2 people, 3 people to go out there from what we learn in this country and implement it back in Kenya. So for example, my approach is actually in patient care. I'm looking at the triggers. That's something that people don't look at in Kenya when they're delivering mental health. The stigmatization. There's a huge and a lot of stigmatization to people who are addicted to, you know, substances and addicted to drugs. There's a lot of stigmatization when it comes to mental health. I learned that when I was out there. And also the delivery of care from how we deliver care here versus how it's delivered back at home, there's a huge difference. And so I'm not saying I'm perfect, but to try and fill in that gap, I went and I trained my employees how I was trained in the United States. And so that's how we are doing it, and that's the best thing. The one thing I want to know is what are the triggers. So when I talk of the triggers, we are working on the families, not just the patients.
Okay.
So in order to make that change, I'm not just looking at my patients who come to the rehab. I'm looking at the families, the husband, the wife, the children who are all affected by drug addiction and mental health. And so when you do that, then they have a great understanding of what it takes, because it does not just take the patient, it takes a wife being a patient with the husband, understanding that addiction is a disease.
Yes.
And so when you look at it that way, you're able to educate people, to give people a better understanding of what substance abuse is, what you're going to see on an alcoholic versus a cocaine user. And so this way you're able to understand what else, what other steps you can take to helping this person. It does not just take a healthcare worker, it takes the whole community to understand, what addiction is.
Yeah, and you're right, because a lot of times when somebody is going through addiction, it affects the whole family, and that is so important that you're helping the families as well. What are the challenges you face when you're running business between here and Kenya?
I think the major or the most draining challenge that I'm facing is the time difference, because I'm a very hands-on person. And I think that's my weakness. I'm hands-on, and I want to be there when they're working. Plus, I have other companies here. So the time difference is because during the day here, it's nighttime there, and nighttime there is our day here.
Oh, so you are on 24/7.
I'm on 24/7, but thank God I'm finding a balance finally. So what I have been doing is I'm up till like 11 p.m. So if they have any questions for me, they know between now and 11 p.m. before she goes to sleep, you can, call and reach her out. And I've learned to switch off my phone, because I would leave it on and they would just call me out of the blue. So I would hardly get any kind of sleep. Yeah. And during the day here, I have to function, I have targets, I have goals. So it was really affecting my functioning here versus functioning in Kenya. And now that the company is stable, we are at full capacity, thank God.
Oh,
and
you are?
Yes, we are all set up, and I have the best team, like I said. I'm able now to catch some sleep finally. The other challenge is I have to travel there, back and forth. So what I did in the month of June, since I have children here, I had to go there for a whole month, train the staff, and then I came back for 2 weeks, and then I turned around and went back to Kenya. So the month of June, between June and August, I was here for only 2 weeks, just to say hi to the kids, spend some time with the kids, and then I had to go back. But I thank God that I'm able to do that, and I am up to the challenge and to the change that, I hope I'll be impacting a lot of people. I think that's the most challenge. Otherwise, I'm loving the new venture, and I'm praying that everybody walks with me and supports us out there. And I'm sure we will do the best we can.
Wow, I love that go-getter kind of woman you are. Nothing stops you, for sure.
I thank God.
Yeah. Now, I would like you to tell us about where do you see yourself 10 years from now? Because I see you moving to Kenya very soon.
If that's God's calling and it's God's right time, I would love to move to Kenya. We have the best, I think, the climate and the food just
right,
like I just want to be there. But I also love the US. Every place has its advantage and its disadvantages.
That's right.
Moving to Kenya is not right now, but in terms of 10 years from now for the company and for the venture and for New Health, I see ourselves being in so many counties and being able to impact a lot of families. That's my goal right now. So my goal is, as of February of 2022, I want to be in Kilifi, and then from there, the next place I want to be is in Kiambu. I know God will, see me through that and see me through my dreams and everybody's dream and prayer. So I'm calling everybody to pray with me and be there for me and support our venture. I'm looking for all the ideas I can get. Any kind of idea anybody has out there, I'm willing to take it.
Okay. So Christine, over here I've known you doing hospice now back in Kenya you were doing mental health. Why mental health? Why not hospice?
Betty, I don't know if you know this, but I do have a rehab here.
Oh, you do?
Yes. And plus, you know, my mom and my sister are in mental health. So this is a discussion we have had as a family back and forth, because I come from, you know, a mom who is in mental health and it's her passion. And then my sister who is in mental health and she enjoys it and it's her passion. So I think that plus starting a rehab here that's doing so well, that drove me into wanting to do something for my fellow Kenyans, my family back at home.
Yeah.
That's why I went and ventured into, you know, mental health. But it's not new to me because I've done it here,
Okay.
and it's just something that I took from here and duplicated it in Kenya.
Oh, that's amazing. And you're doing a wonderful job for our people.
Thank you.
And I am so glad that you are also educating the families as well, because most of the people, they don't want to come out. And they, because of the stigma and everything, they don't want to come out. They get ashamed, and you know how our society is, and we judge people. We like to shame them, even on social media, as you said. You know, it's wrong. Could you please give us a parting shot and also talk to the people who are going through this?
My parting shot would be to let everyone know that mental health is a disease. And I used this example the last time I was interviewed in Kenya, actually on Switch TV. I realized I used to, because I work for the terminally ill patients, and up until I got into mental health, I did not realize that mental health is a disease like any other disease. And so for that reason, my sister one day educated me she gave me an experience that she had faced at work. And I'm willing to share that because I think it was like an eye-opener for me, where we were discussing, I have always felt that the terminally ill patients, it wasn't by choice. When you get cancer, or when you get HIV, or when you get something else, and it leads you to the grave, it's not by choice.
Yeah.
And so I used to compare that to mental health, and I was totally wrong. And the reason why I realized I was totally wrong is because some of the addicts or some of the family members who go through addiction, it's not by choice. So what my sister told me during one of our discussions, because we normally compare notes, is that she had met this patient, and the patient, you know, we normally take the history and the physical of patients when they come in. And while she was doing the history and the physical of the patient, to understand the history, the triggers, why are we here versus where we were before, or where are we looking to go from here. The patient did inform her that when he was a child, like around 6 months, the father would take his milk, his formula, and he would add alcohol into his formula.
Oh dear.
And then when he grew up to be like 6, 7 years old, he would take meth and add it to his drink or whatever. So this patient really did not have a choice.
Yeah.
He ended up being addicted because the only life he knew was that. From his formula to his juices to his food, the father actually made this kid a drug addict. So, and that's why I'm insisting to my staff members at New Health, to families, how about if we sit down and we understand, you know, what caused this? What led to someone to using it? Could be peer pressure. It could be other things in the family. It could be like when I did the interview, it was from joblessness. A man feeling, I am not supporting my wife. I love my wife, I love my children, and I want to be the man that I want to be. But because of how the economy is, someone was laid off, you know, during the COVID pandemic and all that. And so they feel hopelessness. And what I want to tell people, it's nothing new. It's being faced all over the world. Even for us here in the US, a lot of companies have suffered, a lot of families were laid off. But you know what? It is not the end of it all. You can still seek help and lead to sobriety. So we are here at New Health to walk with you through the journey to outpatient, and we are going to work with you. We are going to educate you, and anyone who has a person who is addicted, who is suffering, we are here to help you. Betty, I would like to share our numbers, if you don't mind.
Yes, please.
Our
Yes.
website. Our website is www.newhealth.co.ke. We also have numbers that I'm going to give. Allow me to, because the numbers, they are very different from our phone numbers here. So I'm going to give the numbers to reach New Health Medical. If you have a need, if you have any questions, if you just want to know what we can do for your loved one, if you have a loved one who is going through addiction and mental health, feel free to call our staff members at New Health Medical and Rehabilitation Center. And our numbers are +254 757 198 975. And our other number is +254 786 599 509. Thank you so much. And once you call that number, feel free to speak to anyone. I would advise that you speak to Esther. She's our marketing consultant. And also Isabel is the director, or Audrey. You're welcome, and we are there to help you every step of the way.
Wow, that is so good. And thank you for sharing those contact information. It's very important. And now tell us, because the last time you were here, a lot of women, they wanted to know if there's something coming up soon, the women empowerment session or meeting or something. They are looking forward for something like that. Please, are you holding something?
Yes, I am. Something? Yes, I am. They actually, a lot of people have called me.
Have they?
I can tell you, I've received calls from Qatar. Thank you so much for your support and supporting Very Easy. I've received calls from all over the world, and I want to say I'm humbled. I'm so happy. And I hope to continue motivating you, because guess what? With God, everything is possible.
Yeah.
And to me, I believe that the sky is not the limit. For me, I believe the sky is not the limit. As long as I have health and I have good, I'm in the right state of mind, I can achieve anything. We are going to be holding our next women's forum.
Please.
Next year in June. So in June, I'm hoping to see you come out and support our venture. Very Easy will be there. There will be so many motivational speakers. So next year in June, I promise you, we are going to have a women's forum that, has been requested by so many women. Thank you so much.
And one thing I would like to tell our viewers is Christine is not just all business. Last week, was it last week?
It was last week.
She had a birthday party for her daughter, and she was having Harmonize here, all the way from Tanzania. Oh my goodness, I had a blast.
I hope you enjoyed it.
I enjoyed it, and I posted that video on my on my YouTube.
You are sneaky. I saw that.
And some people are like, "Is that Christine's home? Is that?" So they still remember you.
They still remember me. We hosted Harmonize for my daughter's first birthday and dedication, and Very Easy graced the amazing occasion. And I did see some comments, people asking, "Is that Christine's home?" Yes, that was my backyard. But what has humbled me is the positive support that we are receiving. But also negative support, negative criticism helps me grow. What I'm doing, I've learned from someone else. Someone else inspired me. So please, I'm looking forward to your feedback, and I hope I can continue motivating women. I'm a single mom of 5, and I can tell you, it takes God's first.
Wow. And I'm a single mom of 2, guys. I always share with you that. So anyway, thank you so much, guys, for watching, and thank you so much, Christine, for coming back to this channel. And we hope to have you back here and more. And you have amazing information. Next time, who knows what you're gonna have? You're gonna have a new surprise for us.
Let me know what you want me to share with you, and I'm always here to support you. In fact, I would like to reach out to, if you don't mind, Betty, there's a lady who reached out to me who has a hospice back in Kenya.
Oh.
And I'll be going to Kenya in November, and I look forward to meeting you and visiting your facility. You're doing a wonderful job, and it humbled me. Thank you so much.
Wow, that's so good. Thank you, our viewers, for watching today's video, and may God bless you. Have a wonderful day or night, whatever you want. Take care of yourselves. Goodbye.
Goodbye.
Hello, my name is Esther Njuguna, and I work as a marketer at New Health Medical Center. New Health Medical Center is an alcohol and drug abuse rehabilitation center located in Kitisulu, Nairobi, Kenya. The foundation of this rehabilitation center was based on a vision to create a facility that felt more like home, than a hospital. We at New Health Medical Center understand that healing can only be initiated in an environment that feels safe and comfortable. We provide services such as detoxification, drug screening and testing, psychotherapy services, psychiatric evaluations, aftercare services, and institute and corporate programs. New Health Medical Center is set in a tranquil environment. Our accommodations include ensuite rooms for our residents, a large kitchen with an executive chef, a fully equipped gym, library, counseling rooms, large gardens where sometimes we host our group therapy sessions. We also have a fully equipped and fully staffed clinic for both inpatient and outpatient plans. Allow me to take you on a brief house tour.
Welcome to New Health Medical Center. This state-of-the-art building is located in Kitusuru along Old Kitusuru Road. This building is therapeutic and welcoming. So please come with me for the building tour. And as soon as you walk into the building, you are met by the lovely receptionist. She's always happy and willing to assist you. And then you get to meet the amazing staff. They work tirelessly to meet the patient needs and to facilitate their safety. The amazing staff always ensures that the facility is nice and clean. As you can see, the bathrooms also are wide and spacious. And also, as you can see, the rooms are spacious to emphasize on dignity and privacy of the patients. You can see the beautiful dining area. And not forgetting the one and only Mr. Chef in the building.